Hello everyone, this is Roshni. Welcome back to my channel, the IEN to RN Journey by Roshni. How are you guys doing? I hope you guys are doing okay. In my last video, I talked about how to apply to become RPN through CNO, and I also gave you guys some information about my journey, how I did it, and all the process that are required, and also the requirements that are to be met in order to become RPN in Ontario. So in this video, I will give you guys information about REXPN, the examination that we are supposed to pass to become a RPN in Ontario. So REXPN means Regulatory Exam for Practical Nurses. It's a licensing examination for RPNs. So this exam is designed to assess whether an entry-level nurse has the knowledge, skill, and judgment required to provide safe and effective care for the patient or not. So REXPN is a computerized adaptive test, which means the exam adapts to the difficulty based on the test taker's performance. For example, the system adapts to your ability of you answering the questions. So if you are answering questions correctly, then the next question becomes harder. But if you are answering incorrectly, then the next questions become easier. Once your application is reviewed by the CNO and they approve you to write the REXPN exam, CNO sends your information to the Pearson View, confirming that you are eligible to write the REXPN exam. And the next step for a candidate to do is register and pay for the exam on Pearson View. You can go to the Pearson View website, create an account, and register for the REXPN examination. You're supposed to pay the fee of approximately $350, and after that the candidate is supposed to wait for another email from Pearson View that contains ATT, which is the authorization to test. So you will receive your ATT via email, and your it will contain all the information about your candidate ID, which is very important in scheduling the exam. And the validity period of ATT is 90 days. You must book within the 90 days of the time and the date you received your ATT. And they will also have instruction on how to schedule the exam through Pearson View. It is also very important to schedule for the exam within the ATT validity period, because if you do not schedule the exam, then your ATT will expire and you might have to reapply again and pay for the exam fee again, which is like extra money that you don't want to lose. And ATT cannot be extended. Make sure that you schedule the exam as soon as possible after receiving it. Since the validity of ATT is 90 days, I did not feel prepared enough to write the exam. So I did not book through the Pearson View and register there, because once I would have registered, then they would have sent me ATT. So I waited some time before applying for ATT. So if you guys also are in the same situation that you don't feel prepared enough to write the exam, you can always extend the period and do not request for ATT, and only request the ATT when you feel you are prepared fully to write the REXPN exam. Let's dive into the actual and important exam for us, which is the REXPN. So REXPN ensures that a new grad nurse have necessary clinical judgment and competencies to provide safe, patient-centered care. It evaluates a nurse's ability to assess and manage patient condition, implement nursing interventions, prioritize case based on urgency, ensure patient safety and infection control, administer medication correctly, and follow the ethical and legal nursing standards. I already told you guys the REXPN is a computer adaptive test, meaning the difficulty of the question changes based on the candidate's performance. So the key exam feature is there will be a total number of questions ranging from 90 to 150. So the minimum number of questions that you must complete is 90 and the maximum number of questions is 150. So there's a time limit of 4 hours, which includes the breaks and tutorial time. So some of the question types that you can get in the REXPN is multiple choice questions. So you have to select one correct answer. Select all that apply, which is also called SATA, and you will also get fill in the blanks questions, drag and drop sequencing questions, and there will be case studies as well, and chart based questions. The exam stops when the CAT system determines with 95 certainty whether the candidate has passed or failed the exam, which could be your computer might stop at 90 questions, as it would have already determined whether you are performing above the level or below the level, or sometimes it can go up to 150 questions. I've heard a lot of nurses whose questions stop at either 95, 100, 120, so you never know. It all depends on your performance and how you are tackling the questions that you are receiving in the exam. So during my REXPN exam, my questions stopped at 90, and you can also tell that you're doing really well in the exam if you receive a lot of case study. That was the case for me. So I will now give you some information about what are the main topics that you need to focus on the REXPN exam. So I'll give you a little detailed breakdown on the main topics. The REXPN exam is divided into two main categories. A is client care needs, which contains about 70 to 80% of the question in your exam, and number B is the nursing process, which contains around 20 to 30% of your questions in the exam. So number A, client care needs, is divided into 6 subcategories. So we'll dive into that one by one. So the first one is the management of care, which consists around 20 to 26% of the questions. So under that, you are tested on patient's right and confidentiality, delegation and prioritization of nursing tasks, legal and ethical nursing practice, interdisciplinary collaboration with healthcare teams, and handling patient safety, incidents, and reporting. And number 2 is safety and infection control, which is about 10 to 16%. So some of the questions that you would be tested would be on standard and transmission based precautions such as hand hygiene, PPE, preventing falls and patient injuries, sterile procedures, and infection control. Also, it includes emergency response and fire safety. Number 3 would be pharmacological and parenteral therapy. So the most important in that would be the rights of medication. They might ask you some mathematical questions, and IV therapy, blood transfusions, doses calculation, which I already talked about. So number 4 is basic care and comfort, which consists about 7 to 13% of your questions. So assisting with activities of daily living, pain management, either pharmacological or non-pharmacological, providing mobility assistance, where there might be questions about wheelchairs, walker, crutches, and monitoring hydration and nutrition needs for the patient as well. In terms of psychological integrity, there will be 6 to 12% of the questions, which includes therapeutic communication techniques, recognizing signs of mental health disorders, providing culturally competent care, which is a very important question, and also crisis intervention strategies. And the 6th one is health promotion and maintenance, which consists around 5 to 11% of the questions. Question might be based on patient education on disease prevention, vaccination schedules for adult and children, screening test, prenatal and postnatal care, and growth and development milestones for children. So let's go in number B, which is the nursing process. I told you guys it consists around 20 to 30% of the question. So there will be a subsection of assessment, planning, implementation, and evaluation, which we already have a lot of information about. In the assessment section, it will consist 8 to 14% of the question. So it will include recognizing normal versus abnormal lab values, performing physical examination, collecting data. Number two is planning, which consists 5 to 11% of the question. So it talks about short-term and long-term goals that we already know about. Number three is implementation. So implementation also consists 5 to 11% of the question. So the main focus on implementation is to administer treatment and intervention, educating the patients on health conditions, and also coordinating with the healthcare team. And the fourth and the last one is evaluation, which consists 2 to 8% of the questions in your exam. And it mainly focuses on assessing the effectiveness of nursing intervention and modifying care plans based on the patient progress. To prepare for the exam effectively, I think it's really important to have effective study materials. For me, I refer to Saunders' comprehensive review for the NCLEX-PN, and I was highly reliant on Olympicon exam website. It has a lot of practice question which is in the CAT format. So I think it's very important to use a CAT format and train in the adaptive practice exam in real time, because you will be able to know how the difficulty of question adjusts in the real time, and it will be very helpful in the actual exam as well. I also focused on some of the very important topics such as safety and infection control, medication, and drug calculations. Priority questions is the most important. So for example, they will ask you a question about which patient or nurse would see. I think that was the really important and very confusing topic that you will find. So please practice on those kind of question. And they will also have a delegation question, such as for example, the nurse will give which task or which patient to the PSW. So that was the very important question that you will see in the exam as well. And mental health nursing is also one of the very important topic that you should focus on. And it's also very important to develop a structured study plan and focus on the topics that you know is very confusing and you find it hard. To perform optimally in the exam day is to get sufficient rest the night before exam. For me, I never study the day before. So for example, if I'm writing my REXPN or any exam tomorrow, then today I don't refer to any study materials. I don't think about the exam, and I don't really look at my textbook or any question. I just shut all my study materials completely and not think about the exam tomorrow. It's also important to eat a very balanced diet meal on the day of the exam to maintain the focus. And I would suggest you guys to go early to the testing center to avoid any unnecessary stress, and also use deep breathing techniques to stay calm during the difficult questions, because I will say to you guys that you already know the answer. It's just you have to believe in yourself and never doubt your first instinct and never doubt yourself. That's what I would give you guys a small tips to help you perform really good in the exam. On the day of the exam, it's important to take your government issue ID in the testing center, because they will ask you for a identification, and also they will have a series of security protocols that you have to go through. They will scan your palm vein, and digital signature is also required. They will ask you to take off all the jewelries that you are wearing, and also the belts are not supposed to be in the testing center. They will give you a locker in there where you can put your belongings, and after that you guys will be taken to a spot where with the computer where you are supposed to sit in there. They will also provide you a notebook. Unlike the traditional exam, REXPN does not provide a numerical score. Candidates will receive a pass or fail result within 2 days. So if you pass, the candidate has met or exceeded the passing standard is what you will receive via email, and if you fail, they will say the candidate has not met the required competency level and provide you with the CPR, which is also called candidate performance report, and it will have detailed report highlighting your weaker areas. So for example, if you have done really well in one section, they will write above the passing standard, and if you have done really bad on one of the section, they will write below the passing standard, and if you have done okay with one of the section, they will write near the passing standard. So if a candidate does not pass the exam, they must wait at least 45 days before retaking the exam. So there is no limit of number on the attempts on this new REXPN exam, but back when we had CPNRE, you could only write 3 times in 1 year. And for each attempt, it requires a new registration and new payment on the exam fees. So I suggest you guys prepare yourself really well before writing the exam, so you do not waste your hard-earned money. So we have reached the end of the video. I hope you guys really like the information that I provided, and if you guys have more questions, please comment below and I will try my best to answer all your questions. And also please do not forget to like and subscribe to my channel. Thank you. Have a good day.